Thank all of you for being here with us today, and thank you to Rhode Island Hospital for hosting us. While we know that this is a statewide issue and the fact that most of our hospitals are actually represented here with us today, I'm going to say a few words, and then you'll hear from Dr. Stephen Traub, an attending emergency medicine physician here with Lifespan, Dr. Pari Gopalakrishnan, the interim president and COO of Kent Hospital, and our beloved James Rajat, the chief strategy officer of the Executive Office of Health and Human Services. I also want to acknowledge some of our additional incredible partners with us here today. Jeffrey Liebman, the CEO of CharterCare Health Partners, Dr. Matthew Saracen, the medical director of Landmark Medical Center, and Teresa Paiva-Weed, president of the Hospital Association of Rhode Island, an invaluable partner with us in these endeavors. Why we are here is because we want to bring attention to a very timely and urgent issue in Rhode Island and across the country: the issue of emergency department overcrowding. Hospital EDs across the country are experiencing very high volumes at this time. Doctors Traub and Gopalakrishnan will give you a little more detail on what they are experiencing on the front lines. But from all of our perspectives, I can tell you that we're seeing overall occupancy numbers like 93% of capacity and 98% of capacity. And ICU utilization is at or near 100% capacity. This is the case at facilities throughout the state, and it's true at Hasbro Children's Hospital as well. I'm here with our colleagues because this is a public health concern, and it could become a patient safety concern, but we have an opportunity to do something about it, and that's why we're here to educate you today. So there are many reasons why we are seeing this. Hospitals across the country are experiencing a shortage of clinical staff, in part because of burnout after almost 2 years of pandemic response. I can certainly, and so many colleagues can identify with that. Our heroes who have been healthcare workers on the front lines can only take but so much. Burnout is a normal part to this process, and we have to be able to support them. What happens is this requires many facilities to reduce the number of available beds because of the staffing that they have available to provide care with those beds, and to use the emergency department to then board those admitted patients that are less staffed. Another factor that we have actually been talking about for years is the ongoing behavioral health crisis, which involves patients with some very complex needs. These are all members of our community. James is going to talk about some of the solutions the state is exploring. But in the meantime, we need the support of the public. Many health issues can be treated quickly and effectively by a primary care provider or in an urgent care facility. We have many high-quality ones throughout the state. The types of health issues that can be treated quickly and effectively include less severe cases of the flu. It includes back pain, minor cuts, sore throats, low-grade fevers, and most cases of norovirus, which people sometimes call the stomach flu. If you go to the emergency room for these non-urgent but important health issues, patients will experience long wait times in the emergency department. And patients may end up paying much more than they otherwise needed to. Your primary care provider, urgent care facilities, and even health centers are often much better alternatives for these types of non-urgent health issues that can be treated quickly and effectively in those other settings. We're going to be working over the next several months to get this message out to the public. Part of that campaign is that we're creating a webpage with a list of primary care providers and urgent care centers that are available to you throughout Rhode Island. That page is health.ri.gov/right place, right care. health.ri.gov/right place, right care. It's critical that we get the word out now, before the holidays and before the height of our respiratory viral season. It's flu, it's COVID, it's RSV. They are all out there. We're familiar with them. There are ways to handle them by getting seen and taken care of in the right place to get the right care. We're already seeing flu rates that are considerably higher than we normally see at this time of year. So please access all of the tools that we are telling you exist to keep you out of the hospitals. Please get your flu shot. And don't go to the emergency room unless you need full emergency care. Get educated about some of these non-urgent health issues that happen and that we want you to get taken care of, but learn about other places you can go so that we can keep our emergency departments, our hospitals, and our ICUs available to the people who really need it for that emergency care. So when do you need emergency care? If someone is showing any of these signs, please go ahead and seek emergency medical care immediately. Significant trouble breathing, persistent chest pain or chest pressure, new weakness in an arm, leg, or face, new difficulty speaking or confusion, inability to wake or stay awake, pale, gray, or blue-colored skin, lips, or nail beds, depending on skin tone. Those are true reasons to seek medical emergency care. And our main message here is to make it so that our EDs, our hospitals, and our ICUs are able to have the quality care available to care for patients that need it because of those true medical emergencies available to them. If you're not sure if you need emergency care, pick up the phone. That's a helpful way to get started. Call your primary care doctor or call an urgent care center. We want to support you, and we want this to work well for all of us across the state of Rhode Island, continuing to preserve the high quality care of our health systems, the medical emergency care that's needed throughout the state. You will continue to hear from us on this issue over the coming weeks and months. We want you to stay educated. Make sure you have the support and make sure you know the right place to get the right care. So I want to close by again asking of the public two things. In addition to your COVID vaccine, get your flu shot as soon as possible. And only use emergency departments for emergency situations.